friends. We are continuing our Operation Vaccination special coverage this morning with a look at what doctors from the Women's Clinic in Monroe are saying about fertility and the COVID-19 vaccine.
So, that is the question. That's the big debate that we're having right now, and that's part of the problem that we have is most vaccinations, most medicines, we have time to make a decision on what medicines we give pregnant women. And during this pandemic, everything has happened quickly. We do have, almost 9 month, close to getting to a 9-month vaccination kind of outcomes at different stages in pregnancy. And as of right now, those patients that we have seen no outcomes that are morbidity or mortality. Now, what are we going to see in 3 to 5 years? We can't answer those questions. It hasn't been here long enough. But we have also seen extreme critical illness, maternal death, fetal deaths from COVID. And so that we do know. And so it's weighing the goods and the bads. And that's why, as our women's OBGYNs, we understand both situations and we support the decision that they make. But, the messenger RNA vaccine has been studied long past COVID. It's just never been released so quickly. And so from what they're saying, that's what we have to trust is our clinicians' research, our governing body that do this clinical laboratory studies. And so that's why we support it.
There's a lot of information going on around about the COVID-19 vaccines, but it may not always be factual. St. Francis doctors are now sharing some of the myths behind the COVID-19 vaccine and what you can expect when you get it.
So some of the vaccine hesitancy out in the community or some of the common vaccine myths that people are concerned about, and we can talk about those just a little bit. The first one and the biggest proponent of vaccine hesitancy in our community is young females being concerned about fertility. This has been traced back to a social media campaign by an anti-vaxxing organization in Northern California and spread across social media and spread by word of mouth. But this is completely false. There's no association with infertility or decreased fertility with the vaccine. People are also concerned about the vaccine affecting their DNA. This is scientifically impossible. That's not how the vaccine works. It does not permanently affect your DNA in any manner. Also, obviously, there are no tracking devices or magnetic devices associated with the vaccine. A lot of people are also concerned and hear that side effects of the vaccine may be worse than the virus itself, and this is completely false as well. When you get the vaccine, you can expect some soreness at the site of the injection, some redness. Some people have headaches, fatigue, low-grade fevers, and some flu-like symptoms, but nowhere near the symptoms that you would experience with COVID-19 if you became ill from contracting the virus.
Now that we have put some myths to bed, many may be wondering why vaccinated people are still getting COVID-19. Here's what Glenwood Medical Center in West Monroe is saying about that.
Well, as we knew going into this, the vaccine was not going to be 100% effective. Initially, we were told it was going to be about 90 to 95% effective, and that is borne out. It's about 90% effective, which means that 1 in 10 people who get the COVID vaccine will still get COVID-19. For example, 90% of the cases from July 15 to 21 of COVID were in unvaccinated patients.
While the state of Louisiana has the highest COVID-19 cases in the state, there are some differences with the COVID-19 numbers between North and South Louisiana. Here's what the Louisiana Department of Health has to say.
Our state is the highest in numbers, and we may not see the true devastation in our state because South Louisiana is so much worse off than we are up here in Region 8. Of all the numbers in Louisiana, Region 8 only has 8% of those cases. And our hospitals are already full, so you can only imagine what it's like in South Louisiana. And just like St. Francis is getting some staffing right now through one of these federal agencies to help with it, there's several hospitals down south that are doing this. So we're just kind of seeing the tip of the iceberg because it's even worse down there. So if people say they don't realize it or see it, we're actually very fortunate up here to not even see the worst of Louisiana.
And the surge is also on the rise in Arkansas. If the number of COVID-19 cases increase more throughout the state, the Department of Health says they've been working on a plan in the event there's an extreme surge.
earlier, we had built out alternative care facilities that at the time, we built them in preparation for a potential surge, but we were able to kind of get increased capacity in individual facilities throughout the state and didn't necessarily need to use those beds that we built. Well, those plans are still in place. And so we have that capability to put folks there. Again, the limiting factor is going to be staffing. We need people to be able to take care of the folks that are in those beds. And so the plans are there. The staffing at the moment is not. So that's what we're working on. We're working very diligently with like I said, our FEMA reps and hospital association, and just kind of all heads coming together to try to mitigate this problem.
To find a vaccine location near you, go to our website, miraculemiss.com, and click on the Operation Vaccination tab at the top of the page. Coming up next on Fox 14, more Operation Vaccination coverage. Plus, Lexi is here with the full forecast. Stay with us on Fox 14.